It was wonderful for us to be able to share the seminar with some incredibly inspirational people, and I'd like just to introduce a couple of those people now. Would like to talk about the main themes that you were bringing up in the seminar today?
Yeah, I thought it was a fantastic seminar as you two organised, and I think some of the key aspects that I feel are important in there is first the notion of the healthcare model, and I change that and I say it's a disease care model that we work under. So we have to really be aware that we are working with the assumption that there's a problem to fix, be it anatomical or structural, really pinpoint the problem. And that's not what it is. We're dealing with an individual that's in a societal context, and so we have a wicked problem, as you said. Another key point for me is that people are under influence. And when I say people, it's patients, it's healthcare providers, and it's the payers and the public in general. And they're under influence from beliefs, cultural beliefs. They may be spiritual, as we heard as well, in some countries.
Wasn't that interesting?
Very interesting, yeah. And also they're under the influence of the media. And there's so much stake out there, as in financial, so much business, so much money being made. If we continue with this inefficient model, a lot of people are actually going to lose their business. So the incentive is not right to move to a value for the patient model. From there on, I think that what we can do is contribute to the education of, first of all, the professionals, and to help them understand all these contexts and the steps to move towards value-based care. And we need to work within different organizations, different professions, to move towards true interdisciplinary care, where we all learn from each other. There's different capacities, competence in different professions, be it the medical, be it the physiotherapy one, be it the activity for health professions, and so we really need to get people together.
So I'm interested, Boris, in your, obviously your background as you're a medical practitioner, a sports physician, that we have a clear understanding in health around the management of diabetes. And I think one of the things that was brought out in the paper was that we have this chronic health model that we all agree on for some health disorders, but for musculoskeletal pain, we haven't been able to do that. Why do you think that is?
Well, I think one of the problem is, if you look at diabetes or blood pressure, for example, it still relies a lot on the correct pill at the right dose. So we're still within a fixing model, and we're treating that disease. Whereas for musculoskeletal, there is no such pill, there is no such exact dose that you can prescribe. One way that we've looked at it from the medical side is to start prescribing physical activity or exercises literally. So I'll take my notepad and I'll do a prescription with the exercise, and I'll draw stick figures and all that. And we know from research that works a bit more. It validates what you're saying. But we're not changing the model. We're adapting to that model, and the model is wrong. It's not the way we navigate within that model. So I think we have to think a bit meta, broader, and really go back to the education, but not just at the professional, but also in schools, also for sports and coach education programs, and really all those stakeholders need to be involved.
That's awesome. Thank you.
What do you think will happen if we don't change the model?
Well, the thing is, money's going to run out in a way. It's just like a financial crisis or a real estate bubble or something. We are in this bubble, and it is going to burst. Every country is spending more and more on healthcare or disease care, so it's not going to stop. That model is not sustainable. So we need to act, for sure.
Thank you very much.
Thank you.